Very good evening, one and all, and warm welcome to today's webinar. Anxiety disorders are far more common in India than we ever thought of. Evidence tells us that 45 million patients have anxiety disorders in India. So, today, on this special Mental Health Day, we have esteemed speaker Dr. Harish Shetty sir with us to throw more light on anxiety management. And I have the honor of introducing sir. Sir is consultant psychiatrist at Hiranandani Hospital, Mumbai, has over 42 years of experience in psychiatry. He is member of Indian Medical Association and Indian Psychiatric Association. His expertise involves in depression treatment, violent patient management, suicidal behavior, and de-addiction. He has taken various initiatives and is involved with national level organizations and bodies to improve and drive mental health of general population. With this, we welcome Sir, and Sir, over to you.
Good evening, everybody, and congratulations on the World Mental Health Day. The topic is workplace stress, and anxiety is a part of workplace stress. Let me give you a brief about what anxiety is all about. Let's not view it with the medical model alone. Let's view it with the sociological model. What is happening to the world? Globalization, rapid pace, rapid changes across the earth and India, post COVID. And there are certain specific worries. One is uncertainty of the future. And the second is daily anxieties. Third is fear of what will happen to my children, my parents. And the fourth is no time to rest. Fifth is sleep, compromised. Seventh is gadgets causing sleep deprivation. And sleep deprivation is insomnia. And there are a host of all reasons across the world that makes this 8 billion people that habitate the country, the world, anxious. Today on the World Mental Health Day, it's important to prioritize work in health in workplaces. Look at this case, 40-year-old married women. Soti nahi hai, headaches, tight muscles, backache. She has a long-term worry about several life situations. Health, savings, job, and her teenagers' problems in college. Sometimes she says, I'm very depressed, I'm sad. She never took alcohol or substance to heal her. She never went to yoga, vipassana, or any form of meditation. She has come to our clinic many times. Let's look at the burden of disease due to mental illness. The burden is huge. 1 out of 8 people across the world are mentally ill. India, it's 1 out of 7 people across the world are mentally ill. 2016 National Mental Health Survey said that 80.4% of them needed treatment. They also said 1 out of 10. But again, 2019, Lancet and the government of India said it is 1 out of 7 Indians are mentally ill. And there could be different reasons. COVID has added to the anxiety because of physiological changes in the body, because of fear of uncertainty, and so many other things. There are hardly any mental health professionals, but you don't need mental health professionals to treat anxiety. You need the family physician, physicians, and non-psychiatric professionals to treat anxiety. Anxiety should not be treated by psychiatrists, it should be treated at the general practitioner's level and the MD physicians and every non-psychiatric consultants. You're aware of the stigma, but I would not like to go into that. Let's come back to the case. What is our provisional diagnosis? It could be many. It can be just generalized anxiety disorder. If you rate them on generalized anxiety disorder scale, which is very easy for you to use in your clinics, she will share with you about her lifestyle, exercise, sleep hygiene. And I saw 3 patients today in my World Mental Health Day celebration that they will take Big Bull to bring down anxiety. It will make them worse. Big Bull has a lot of caffeine. Please tell all your children and your patients not to have drinks which have a lot of caffeine. Since she has anxiety and she says, I'm also depressed, she could be having dysthymia. She could be having depression, or she could be having plain anxiety. Well, it has been believed that alprazolam also had antidepressant activities. It is believed that etizolam has antidepressant activities, but I would not agree to that. I would say etizolam is a pure anti-anxiety drug, non-sedating and non-addictive. And these are the 2 important qualities as compared to all other benzodiazepines and other molecules which are used for anxiety. 9th leading cause of disability, and in the global burden of disease, it is approximately 3%. What happens to anxious people? When people get anxious, the hypothalamo-pituitary adrenal axis goes for a toss. The pancreas starts going on strike and say, I will not give you insulin. Thyroid says, मेरे पास hormone नहीं है. Acid says, I'll fill your stomach with a lot of acid. And the cholesterol says, and the calcium says, and the plaques are formed in the heart vessels. When people who are anxious tend to take alcohol, and it suppresses anxiety for some time. They might take drugs. A lot of alcoholics who come to, if you go back in the history very properly, you'll find that it all started with anxiety. And as of now, they have tolerance and dependence, and they need to be detoxified. And once alcohol moves away from the system, the brain settles down in a month's time. If you treat anxiety by non-pharmacological methods or pharmacological methods, their chances of stopping the substance is very high. Remember, when you screen a person with substance abuse, take him or her, and that's the last patient of the day, and go in depth into the history, dig the history, and they will say, most of them will say, I was scared at the time of exams, I was extremely anxious at the time of interviews and meetings, and I slowly started taking little alcohol, and I found I could calm down. And then what happens is tolerance. The little alcohol is not enough for him to feel better. He takes more. Dependence, as he stops alcohol, he gets a lot of withdrawal symptoms. And alcoholics, actually, when they become chronic, they don't drink for enjoyment. They drink because they want to avoid the withdrawal symptoms. So if you go in the history, you'll find anxiety was the precursor and the cause. Anxiety can be treated easily. And there are different forms of anxiety. I cannot meet people who are in the higher social ladder than mine. I can't meet people who are above me, or who actually are very powerful, MLAs, MPs, managing directors, vice presidents, bosses, etc. And that's social anxiety. Separation anxiety is, I do not feel like going to school. I want to cling to my parents. I can play down, I can go for a party, I can do everything, but just that I cannot go to school. And that is so difficult. That is known as separation anxiety disorder. And these kids look completely normal. And nobody believes that they have anxiety. But they have a typical anxiety where they do not want to abandon their parents, they want to cling to them and not go to school, college, or office. Phobias. It could be related to heights, closed doors, open doors, darkness, where you get a panic attack when you are exposed to such a situation. Panic disorder, just the heart starts beating faster, breathing is difficult, sweating, tremulousness, tremors, increased micturition, lightness in the head, and many other symptoms. And that's a panic disorder. Generalized anxiety disorder is continuous state of anxiety. Now, we need to look at other conditions also. Thyroid is one test you need to do. Look at ECG to see whether there's atrial fibrillation. Look at chest diseases like asthma and anxiety are correlated. Well, it is associated with nutritional deficiencies. In a patient of diabetes, when they say his heart beats faster sometimes, check his sugar. Has the sugar gone down? In some patients, it could be hypoglycemia. Neurological, Parkinson's disease, dementia, delirium, ENT problems. Sometimes, very rarely, epileptic attacks can also be associated with anxiety or any brain problem. My dear friends, एंजाइटी इज ऑलवेज अंडर डायग्नोज, सबको होता है. टेंशन स्ट्रेस तो आता ही है ना, स्ट्रेस के बिना जिंदगी क्या. पर एंजाइटी से मुझे काम नहीं होता, आई कांट वर्क, माय एफिशिएंसी हैज गॉन डाउन, and I get fear of fear. That is, if I had a panic attack, I'm scared that the panic attack will come back to me again. Fear of fear is very, very dangerous. Psychoeducation is very important. Remember, one explanation about anxiety to the patient does not work because there are a lot of myths in the mind. Myth is it is a heart attack. I have a sense of impending doom. कितना भी कहा तो मुझे लगता है कि heart attack है. I feel it's a heart attack. So what happens when you educate? Educate is not transaction of information or giving information. Education is slowly transacting it so that the patient expresses all their myths. As the myths leave the brain, there is space for science. When myths leave, science goes inside and it settles down. And then introduce the patient to somebody else who has come out of anxiety. Ex-patients who have recovered are the greatest ambassadors of mental health. And also involve an ally in the treatment, which means wife, husband, brother, sister, or son, who would keep the patient in treatment and also not make him rush to hospitals again and again for multiple ECGs and his fat file. What is very important is if one doctor does an ECG and say, "Isme thoda problem hai," even by mistake, the mind tells him, "I was right." 9 doctors said nothing is wrong. This one doctor said there's something in the heart. And then उसको समझाने को इतना टाइम लगता है. So it's important that you involve others and allies who are normal so that the patient is in treatment, is compliant, does not go around trying to experiment and go to different doctors. A fat file patient largely is a patient of anxiety. This you can use in your clinic, each one of you. There are 2 scales which you should use. One is PHQ-9 for depression and GAD-7 scale for anxiety. Last 15 days में ये 7 in this among 7 symptoms, if you have been in 1, not at all 0, several days 1, over half the days 2, nearly every day 3. And then if you score more than 9, screen the patient for anxiety neurosis, for phobia, for social phobia, for any separation anxiety disorder, and also for depression. Sometimes in the elderly, major depressive disorders can come as anxiety. Knock the door of anxiety, and then you'll find something behind it. My teacher, late Dr. N.S. Vaya, always said anxiety is the mother of all psychiatric illnesses. Treat them early so that you get much better. Also, in a stress-filled world, you get anxiety. If you help people treat their stress early, you'll prevent anxiety disorders and also depression. But some are prone because of genetic reasons. Well, the neurobiological mechanisms, there is glutamatergic mossy cells, neurogenesis, which happens. Neurogenesis is actually generating cells in the brain, which happens across life by doing different activities of stimulation. What happens is there are changes in intrinsic excitability or synaptic plasticity of certain dental granule cells. There's a problem in the processing of information and there is wrong contextual fear processing, which is linked to, and this is one hypothesis. Hippocampal activity and other brain regions are also associated. Now, what happens? How do these two diagrams help? Those who are skeptical about treatment of mental health and those who are very cognitive and they want a scientific explanation, just these two drawings help them to understand that this is something they need to really take care. There is something physiological happening in the brain. It's not just hypothetical anxiety. There is something happening in the brain, and brain education is very important. After assessment, now in India, you can't sit and do everything what the Americans do. They have time, they have insurance, and they will follow everything to the T because insurance pays them and the consultant they have treated, they don't change the consultant so easily. After assessment, collateral information, ask the relatives, share market mein kuch paisa gaya hai kya? Has there been a breakup? Has there been a pink slip in the job? Has there been any mild to moderate stress? Has a boyfriend of the past or a girlfriend of the past has contacted this patient? Is there loss of job? And so many reasons. Ask collateral information. Remember one thing: if you want this information, you have to spend time. That means last patient per day. Diagnosis एक बार कर जो मोटा मोटा. Education cannot finish in one session. It can be an incremental every session. Re-emphasize the science, explore the myths, push science in the head, and you'll find that you have dented the myth. And if you dent the myth, there's a chance that he will take your treatment. Therapeutic alliance is a theoretical word. Rapport building is the real thing. If he has faith in you, or she has faith in you because of your being the doctor in the past, or he is convinced that you are giving him the right treatment because you have given him an explanation, you plan the entire treatment and start your entire treatment. Now, some people would say, "Dawa nathi levanu, mujhe dawa nahi lena hai. Nok marnd venda, yenk mard burchi, maka bhoy zata, maka wakkad naka." And if it is so, then you should try different psychological interventions. I would say much more than this. Try yoga, pranayam, shavasana, and basic Ashtanga yoga of Yama Niyama and others. When the sympathetic tone goes down by yoga, the noradrenaline drive which anxiety does do also slowly goes down. Along with that, if you have somebody who is too strained in cognitive therapy or behavior therapy, that's also good. Jacobson's relaxation method is just a modified pranayama, where we believe that when the somatic body calms down, the psychic anxiety also goes down. And it's important for us to use this. Well, there are many medications which you can give, which is very important. Nutrition, excessive fasting can cause anxiety. Exercise dissolves tears, fears, and anger. Extremely important. You can use either of that. Well, these are the medications which are used. SSRIs. Lastly, fluoxetine has been used for a very long time. Acetylopram has been used for a very long time. Sertraline also has been used. And it's important to understand that diazepam is not used anymore because of its long half-life. We don't use it at all. Instead, we use short-acting clonazepam, which works very well. Oxazepam is also a good drug. Midazolam is also a very good molecule. But if somebody comes with a panic attack, give him 1 mg to 2 mg of clonazepam, it stops. And then maintain and withdraw the clonazepam as soon as you can, because it can cause dependence. Etizolam at that point of time is very, very good. What's very important to understand that small dose of tricyclic antidepressant, imipramine, amitriptyline works. Nortriptyline also works. Venlafaxine in very small dose, 25. Buspirone has been claimed to work, but I don't see any results. All benzodiazepines work. Paroxetine is a very powerful SSRI. It has more power than all the other SSRIs, but it causes weight gain and causes sexual adverse effects. We have to be very careful. I would say if you are a non-psychiatric practitioner, you can use tricyclics, fluoxetine, acetylopram, or sertraline, along with etizolam. If you're scared of dependence by other benzo, Diazepines, that's a good thing to start. Now, what is post-traumatic stress? It is basically after riot, you get images of the riot. After you've taken care of somebody in the ICU, you get images of gasping of your mother, father, which comes to you, which remains inside. If you're met with an accident, the entire accident moves in your mind as an intrusive thought and as an intrusive memory, and you might get startled at night, nightmares, insomnia, because the story perpetuates the anxiety in the body. And what is very important at that time? Sertraline, fluoxetine, escitalopram are very good drugs. But in case the anxiety continues, you can add a benzodiazepine, clonazepam. You can add lorazepam, but you can also add etizolam, because etizolam is not actually very addictive. My dear friends, as we see, generally, protocol doesn't work in practice. You give a drug, the patient improves, and once the patient is better, after 4 to 8 weeks, slowly start withdrawing clonazepam, and you can maintain the patient with the medications which has really worked. I would say if there's depression, you should promise the patient at least 1 year of medication. Use the word at least, because everybody would not stop at 1 year, because at least would mean सभी को 1 साल नहीं, कुछ लोगों को ज्यादा भी लेना पड़ेगा. And those who are born with an anxious brain, genetically very anxious, father is anxious, daughter is anxious, everybody is anxious. Alternative methods like yoga, vipassana, shambhavi mahamudra, and sudarshan kriya or tasbih or rosary, along with medications, also really work. Now, you have to assess the medical causes also, and the substance use, you need to treat substance use. Now, non-pharmacological, I'm very sorry that I have not put basically yoga. Yoga is a powerful anti-anxiety agent. In fact, more American children practice yoga than Indian children. In Australian schools, yoga is mandated for children. Can you believe that? It is basically because of its principle specific. And in Australia, they don't say, I will not do yoga because I'm from a different religion. Yoga has got nothing to do with any religion. It basically resets the entire body. Basically, yoga resets the entire mind. Yoga basically aligns the sympathetic and the parasympathetic nervous system. It aligns the mind and the body. It aligns the being to nature. My dear friends, those who live in jungles, in tribal areas, children or adults, are more calmer than children and adults who live in concrete jungles, because those who are in touch with 5 aspects of nature, Pancha Mahabhut, 5 elements, Agni, the sunrise or the sunset, water, jal, that is, if you have a long bath and you play with water, earth, matti mein bachchon ko khelne do, they are much less anxious, they are grounded, air, which is so important, and the sky. Those people who manage to touch some green, look at the sunrise or the sunset, feel the air on the body, look at the sky, and play with mud, and in touch with, walk on the mud or the grass, and don't mind having water all around them, do much better. Yoga, Vipassana, Shambhavi Mahamudra, and any other form of meditation which you like. Dance is also a form of meditation. Many women who are very bored at home, I prescribe dance, their entire biological systems come back to normal. Panic attacks actually go down along with other forms of treatment. Well, CBT is said to help. REBT is also said to help. Deep muscle relaxation also has really said to help. Deep massage, if the person enjoys, also helps relax the person. At the same time, telling the person that the anxiety attack is the brain playing games with the body, and you tell yourself, calm down, and you can really enjoy the panic attack without rushing to the doctor. I'll give you an example. If you have seen the film The Beautiful Mind, towards the end of the movie, when John Nash goes up the staircase of a building, he hears a hallucination. He hears a hallucination, auditory, and then he looks at it, but he ignores the hallucination and goes up. Similarly, we can train the person to ignore the panic attack, telling them cognitively, ye mera bheja, mere sharir se mazak kar raha hai, and that also really works. My dear friends, first line, basic counseling, forget psychotherapy. आप ठीक हो जाओगे, लंबा सांस लो, नौकार मंत्र बोलो, गायत्री मंत्र बोलो, अपना नमाज पढ़ो, फजर से लेके ईशा तक 3 नमाज तो कम से कम पढ़ो. Or use any form of prayer. You can say Khandavala Namaskar Kara, Kaviral Namaskar Kara. You can say Ganpati Stotra Mana, Ram Raksha Mana. रोज प्रार्थना करा, आई बाबांचा पैर धरा, रिलॅक्सेशनचा व्यायाम करा आणि त्याबरोबर औषधं घ्या. CBT is really touted to be the best, but CBT is what? Helping change the cognitive distortions in the brain. And one exercise you can do is when you have a panic attack, just write down your thoughts, feelings, sensations, and behavior. Thoughts, feelings, sensation, behavior, and look at it. And slowly find irrational thoughts slowly going away. And irrational thoughts, I feel I'm going to die. No, but that's not true. And you look at it and you find that alternate rational thoughts come and slowly, progressively, the panic attacks actually go down. Well, SSRIs, very true. Small dose of acetylpram, small dose of sertraline, small dose of paroxetine. For me, paroxetine is not a good molecule because it causes severe side effects. Unless the anxiety is very severe, I don't use really paroxetine. Fluoxamine, yes. And sometimes small dose of amitriptyline and small dose of etizolam can really, really work. My dear friends, recommendation, I don't care. Evidence is important, but don't be obsessed with evidence. 4 गोला को एनालाइज करके सृष्टि का वर्णन नहीं कर सकते हैं. But evidence is important, but being obsessed with evidence is a disease. Yes, I would say that children, I would use fluoxetine, sertraline, and escitalopram. Adults, I will use any SSRIs. If they don't do well with one SSRI, there's a 50% chance that they will do well with other SSRIs. Low dose fluoxetine really helps. In children, you can give fluoxetine liquid, which is available. And I find acidity to be much less when you use the fluoxetine liquid, maybe because of incipient, I really do not know. But tricyclics will cause a lot of constipation, dryness of mouth. Elderly patients, very important to understand that escitalopram is better. Citalopram is also better. But the point is, remember, when the elderly have multiple comorbid illnesses, when you give SSRIs, you can have electrolyte imbalance. So please monitor electrolytes. Please monitor higher functions and start with a very slow dose. As you all know, my dear friends, in elderly, start low and go slow. Well, this is what is recommended now. What is exposure treatment? I'll tell you what is exposure treatment. I have had an accident in a car. I've repaired my car. It's lying in my garage. I don't touch it. I'm scared to drive. What I will do, I will ask the man or the woman to go and touch the car for 7 days for half an hour. Then I'll ask the man or the woman to get into the driving seat and sit there for half an hour for a week. Then I'll ask the man, the woman to ignite, to start the ignition and let the car race, but don't put the accelerator for 7 days, for half an hour. And then I'll slowly say 50 yards, then 100 yards, then 150 yards. That is known as graded exposure with desensitization. That is so important. Biofeedback works, but biofeedback takes a long time. Supportive psychotherapy also works. Some people are very scared of entering the train. They've never traveled in a train at all in life. I have so many patients. I have taken them to railway stations, watch the train, get into the train and come back for 1 week, get into the train and go for one station and come back, say, walking and graded exposure with decent. Sometimes I had so many patients that they did not go to their village in UP. मैंने क्या किया? Load them with benzodiazepines. सुला दो उनको गाड़ी में. And then slowly, they after they go 200, 300 miles or kilometers, they can't get down. Once they go, they feel very real. If they break the fear once, they will do it again and again. It so happens in men and women when they're scared of intimacy, exposure, which means get close, don't touch anything, slowly mild foreplay, then don't have intercourse, then severe foreplay and strong foreplay. Then even if you have an erection, don't touch, don't enter, and slowly women on top. And no stroke, and slowly through exposure, anxiety goes down, associated, allied with small beta blockers and etizolam or small dose of clonazepam. My dear friends, there are recommendations. but who looks at the recommendation? We have to look at it, mota, and use it for our own experience in our different states. Because every state in India is India by itself. India, there are multiple Indias. It depends on the culture. It depends on the personality. How you negotiate treatment for anxiety. Tricyclics, only in younger patients, above 45, you give tricyclics, look at the QTS interval, and that's very, very important. Benzodiazepines, acute. I still remember this boy coming for a CA exam, completely prepared. Last group, final CA. One group, and he got anxious 7 days before. I knocked him down with benzodiazepines, got better, got sleep, and then slowly gave him Etizolam in the morning, because Etizolam is a non-sedative anti-anxiety, kept talking to him, and on the day of the exam, cheered him up, told him, "Jo ho gaya, give your best." And many of them have crossed the barrier with supportive counseling, with small dose of benzodiazepines and lifestyle management, and constant support by the psychologist or the psychiatrist. You know all these dosages. Antidepressant dose is always higher. Dose for OCD is always higher. Dose for anxiety is always lower. Very important to understand. In pregnancy, SSRIs are safe, but I tell them, do yoga, do pre-nuptial yoga, do pregnancy yoga, do relaxation. If absolutely necessary, take medications. No benzodiazepines during pregnancy. Small dose of SSRIs do. Fluoxetine has been tried in a large number of trials and has been found largely safe, but tell the patient, no drug is safe. We have to do scans, we have anomaly scans, other things. And this is what you need, because during pregnancy, if you get very anxious, the blood supply to the fetus also is affected. The vessels constrict, and you can have other complications. I would not give quetiapine at all. Quetiapine is reserved for a psychiatrist. And then there's psychotic anxiety. I would give a lot of quetiapine, knock them down, and slowly bring them. Pregabalin, yes, but not as strong as other medications at all. And other drugs, I've already said. Clonazepam, start with a small dose. Now 0.0125 is available in India. Lorazepam, 1 mg, 2 mg, and 3 mg is available. Start with a very small dose, increase it, keep talking to the patient, otherwise he will go to some other doctor. Remember, these are the things which they say. Mera panic attack cure nahi hua. And I say, let's look at this. Achhe din badhenge, bure din kam ho jayenge. We have to look at decrease in intensity, decrease in frequency. When intensity and frequency goes down, then the improvement can be measured. When somebody comes and says, I am not well at all, that means on that day he had many panic attacks, but he had no panic attacks for 1 month. So you need to explain to the patient what is improvement and what is not improvement. Just saying that I will cure this doesn't work. Achhe din aayenge, bure din kam hote jayenge. And these are the drugs which you can actually use. My dear friends, lot of studies which have been used. Benzodiazepines show greater effectiveness than antidepressants for somatic symptoms. I don't agree with this. Dosalpine or prothiodine or Dothip are also very good for somatic symptoms. And if you have a doubt that the patient has anxiety, but also has depression, anxiety, depression, as ICD-9, dysthymia in DSM-5, do use a combination that is very important. My dear friends, all conventional benzodiazepines cause drowsiness, probably cause dependence, and probably withdrawal. Etizolam has the least impact, is less effective than other benzodiazepines, but does not cause these adverse effects. When you look at anxiety, if it's mild, if it's transient, Etizolam support is phenomenally good. And people say that मुझे एक गोली का टिज़ोलाम से अच्छा लगता है, 1 mg का क्लोनाज़ेपाम से नींद बहुत आती है, 0.5 का लोराज़ेपाम से नींद बहुत आती है. So that exactly improves. Now, you know all this tolerance, dependence. Very important to understand that conventional benzodiazepines can cause accidents, pure psychopathological. There are many pilots who are asking me anti-anxiety agents. I do not give them because they're at a very responsible job. But after a detailed chat, I tell them it's very risky, because if they do a test electrophoresis of the blood, or even even analysis of the hair follicle, it can be really discovered. Indian aviation industry is very conservative, unlike the West, who allow the patients to announce and tell them that we are anxious or depressed, and they allow them to fly after they're better. ये एटिजोलम में ना thiopanic ring है instead of the benzenic ring. And a triazole group is bound. So what happens is thiophenic ring readily gets oxidizable, and there's a quick metabolism of etizolam. The triazolic group accounts for compounds pharmacodynamic properties. It causes decreased serotonin turnover. It decreases the stress-induced increase in serotonin, norepinephrine, and dopamine. My dear friends, those who refuse to take etizolam, you can show them this slide and tell them this is what happens. Some people who are very obsessive, meticulous, and they are very cognitive. They need scientific examples, though they don't understand the science. And that is one thing very important. There are 5 types of patients. Obedient, they'll do what they want, what they say. Emotional, they emote with you and take what you think is right. Then there is dependent, and those people take what you okay. Then there is cognitive patient who needs some scientific information here for them to accept etizolam or any Benzodiazepine. And the 5th is suspicious patient. And the best way to handle a suspicious patient is go to some other doctor. When you say go to some other doctor, they come back to you. But if you try to hold them again and again, they get more suspicious. Hamilton's rating for anxiety is also very good, but I would advise you to use generalized anxiety disorder rating, which is very simple. And these are alprazolam, I would advise you not to use, because unless there's acute anxiety where you can give bolus alprazolam 2 mg and then withdraw it very fast, is better. Alprazolam has one of the most powerful withdrawal symptoms, and that causes severe anxiety. Those who have been abusing alprazolam for a long time can have epileptic attacks. At the time of withdrawal, can have cognitive also damage, and that is something you need to really look at. बच्चों में आप एटिजोलम आराम से दे सकते हैं. Can you drive after benzodiazepine? I say no, but people drive, and people who drive, they drive Uber and Ola. I tell them drive slowly, stay away from the car ahead or the vehicle ahead. Don't go on open roads where you have to drive very fast, and that is something which is very important. As you know, etizolam has low dependence and tolerance. You can stop it without any issues at all. But the point is, understand that etizolam has low adverse effect, but in very severe anxiety, it might not work. My dear friends, what is very important is anxiolytic effect without sedation. It does not slow your response on any auditory stimuli. It keeps the person functional. Psychomotor retardation would not happen. Well, Winston Churchill had said, I have a black dog. And what he meant by the black dog is depression. And if you all go to World Health Organization site and type black dog, you'll get 4 minutes video, which actually has been culled from all evidences, which says exercise can decrease stress. Exercise is good for mild depression. Exercise is good for anxiety. Ask all your patients to watch this 4-minute slide video on I have a black dog. Remember, he did not talk of black dog whiskey, and that is something very important for you to think. Well, this is something you can go to Jacobson's relaxation on the net. You can go to Yoga Nidra on the net. You can go to other relaxation exercises on the net and actually calm you down. It really helps. TMS has been found to be useful, but I don't think TMS is very good in very severe depression. 18% of them improve if they don't want to take ECTs or ketamine. And what is also very important, TMS works in OCDs which don't improve. But again, the recovery is very less as compared to ECT, CBT, and ketamine. एंजाइटी सभी जगह है, चारों तरफ डर है, पर डर के आगे जीत है. And जीत is using science rationally, appropriately, integrating the East and the West together and seeing that the patient gets the benefit of both. With this, I stop. I thank you. Wish you a great World Mental Health Day. And three takeaway points. Don't be afraid of using benzodiazepines. Etizolam, in fact, has less adverse effect than benzodiazepines. Keep the GAD scale and the PHQ-9 scale in your clinic so that you can ideally diagnose anxiety or depression. And remember, friends, all of you who are non-psychiatrists can treat anxiety and are supposed to treat anxiety. All of you who are non-psychiatrists can treat depression, which is not complicated. Depression which is not associated with bipolar disorder, not associated with suicide, not associated with substance abuse, not associated with personality disorder. You are supposed to treat depression the way a lot of physicians are mandated to treat anxiety and depression all over the world. With this, I thank everybody for listening to me, and I thank the organizers who have been kind enough to hold this program. Thank you.
Thank you, sir, for that enriching session. So we have few questions from the audience. I'll put out one by one. So first question is from Dr. Pranav, who asks,
From
and
where?
that is not mentioned here. Dr.
Hmm.
Pranav, he asks that anxious parents, rare anxious children, is the adage true from a clinical practice standpoint?
Absolutely. It's also true in many other aspects. If the child is a brat, the parents are super brats. That's also an adage which is very important. Anxiety travels faster than the influenza virus. So an anxious parent can cause anxiety in the child because of his actions. But at the same time, genetically, if you're anxiously wired, your children can also have anxiety, and both the things are good. Such a family, I am doing a 21-day yoga camp at Yoga Institute at Santa Cruz from 1st December. I practice pranayam every day. 10 minutes of pranayam every day, and it works. I practice anapana meditation of vipassana alternatively for 10 days, for alternatively every day. And then I'm still going and doing a 21-day course of yoga at Yoga Institute, 6 o'clock to 7:30 from December 1 to December 22. So, my dear friends, Harvard says, yoga karo. Harvard ne bola hai, Shetty ne bola hai. So I think all of us should use all the Eastern practices, at the same time use medicines when it is absolutely necessary.
Thank you, sir. Next question is from Dr. Rajesh, who asks about cognitive behavioral therapy in
Yeah.
Indian context. So your
Yes,
pulse of history.
absolutely. For a cognitive patient, CBT works. And remember one thing, there can be as many gods as people, so there can be as many therapies as people. But CBT has got a lot of evidence to be working in OCD and anxiety. Now you can go to the net and see CBT for general practitioners, CBT for nurses, and understand the concept of what CBT is. They're very simple things you can tell your. I'll explain to you. मेरा दिल दुखता है, मैं मरने वाला हूं, ये पैनिक नहीं, हार्ट अटैक है. Then I show them evidences. CBT is all about changing cognition evidences. तुमने 1000 ECG किया है, you have been to 3 cardiologists, you have done everything and there's no evidence. Probability of having heart attack is the least. What is the probability of you having a panic attack? Very high. And if you're able to tell your mind that the brain is playing games, the problem is not in the bulb, the problem is in the switch. And when the switch tells you that, nay, this is an irrational assumption, it's an irrational, very bad distortion, and I slowly start believing, and it's sinking inside that this will not kill me. But if I'm able to observe, if I'm able to do a lot of relaxation exercise, the frequency goes down. That's itself an evidence that this is actually going down. There are many distractible and many distractions you can use for anxiety. One is going under a shower, words change the brain, informing yourself, music, running around, jogging, calling a friend, watching a reel, and also deep breathing for some time. The panic attack does not last beyond 10 minutes. And if at all, if it's so severe, sublingual clonazepam, 1 mg of etizolam or 1 mg of etizolam are good substitutes. But if you have a heart rate which is very fast without any cardiac problem, without hypertension, then beta blockers work if you don't have asthma.
Wonderfully put, sir. So next question is, it is from Dr. Ashwin. What are the clinical situations when pharmacotherapy initiation becomes important during the very first visit of the patient in the OPD?
I would say, if a patient says, मेरे को बहुत बार अटैक आ रहा है, आप कुछ अच्छा करो, अब भी अच्छा करो, give pharmacotherapy, don't give him lectures. But those who come and say, कभी कभी आता है, दवा मत दो, और जो कुछ चाहिए आप प्लीज करो, उनको और कुछ करो, और साथ में एसओएस का दवा दे दो, कुछ हुआ तो जबान के नीचे रखो. कुछ लोग आएंगे, सिवियर एंग्जाइटी है, पर मैं दवा खाऊंगाच नाही, मला नको औषध, मी घेणार नाही, काय पण करा म्हणे घेणार नाही. इट्स इंपॉर्टेंट टू हैव अ लॉन्ग लिसनिंग सेशन एंड से 10 दिन लो, उसके बाद हम स्टॉप कर देंगे. आफ्टर 10 days ही कम्स बैक, बहुत अच्छा, अभी मत स्टॉप करो, आप जो जो बोलते हैं करो. ट्रांजिएंट एंग्जाइटी, whether stress can be managed by counseling, you need not give medicine. Breakup हुआ है, मेरे को बहुत होता है पैनिक. Listening to the breakup, allowing the emotions to spill. Why does a story become very dangerous to the mind? Because of the associated emotions. When you allow the emotions to spill, when you help the person to manage the emotions and help make him mindful, stories get quarantined. So sometimes that can also work. All general practitioners and non-psychiatric professionals should do a short course in counseling.
Thank you, sir. So next question from Dr. Richa, who asks, how often do you witness doctors or other healthcare professionals as your patient?
Very good question, Richa. Richa, we are not immune to the illnesses we treat. A doctor is not immune to the illnesses we treat. And so it's very common. And there's a new study which says that a survey that 28% of MBBS students have mental illness, 15% of PGs have mental illness, anxiety, depression are the most common. And the third important thing is there's a study published in BMJ, suicides in women doctors are increasing. Now remember, 50% of those in children who die by suicide is not because of mental illness, acute anxiety. एग्जाम में फेल हुआ, अभी ये छोकरा ब्रेकअप करता है, मैं कूद जाऊंगा. Sometimes I've lost so much money in the market that I feel ashamed to show my face. I'll die. So many of them need health education, psychoeducation much early in life, and to tell them never die for a guy, never die for a failure. And educating kids that anxiety is common, it can come in many situations. You can actually you can talk to somebody at that point of time. The coffee day owner, if he had made a call, he was ashamed that he could not pay 250 crores. If he would have made a call and met somebody, he would have been alive. So it's important that doctors, when they get anxious, please treat it. Stress untreated can become depression. So what happens in anxiety? We cope. We take alcohol, we smoke, we take cannabis, we go to babas, gurus, and then we give up. It is depression. So treating anxiety can prevent depression.
Yes, sir. So next question is from Dr. Somnath. The question is, why is a benzodiazepine and SSRI combination relevant in context of anxiety disorders in India?
Yeah, initially you need to cut down the anxiety, and you have to give some sleep. SSRIs may not cause sleep at all. SSRI may actually alert the patient. Though some patients sleep with fluoxetine, paroxetine can cause sleep, but most of the time it's an alerting drug. So combination helps them to bring to calm down the patient, help him to sleep. At the same time, it helps him or her to feel better, and slowly you can withdraw benzodiazepines after the SSRIs have taken care of the anxiety, have taken care of the depression. But withdraw it very slowly. Give an SOS. Because if he gets a panic attack at night, he will go to another doctor.
And so next question is again a very relevant question from patient's perspective. So what would you suggest to remove the taboo of patients not meeting a psychiatrist, thinking he or she is mad or something is truly wrong
So
with them?
there are many things. One is ambassadors who break stigma are those ex-patients who can talk to the patient. Number two, give them scientific evidence. It is a physiological problem. It's not a problem in the air. And when you give them scientific evidence, people, what has happened years ago when I asked Professor Vig, NN Vig, late NN Vig from Chandigarh, he started psychiatry in 32 countries. I said, why do patients don't actually come to treatment? He said that Indian patients are oral patients. They are oral cultures. They believe in the whispering campaign. मेरा चाचा जाके आया उसका अच्छा हुआ तो मैं भी अच्छा हो जाऊंगा. But I find there's a change. The last 30 years of my practice, I find people bringing my articles, what I've written, asking question and say, तुम्हारे article में तुमने ऐसा लिखा था. So we are slowly becoming a race which believes in the written word. So a lot of evidences. Number three is Patao the ally. Every family has an ally who's the decision maker in medical treatment. Patao the ally, ensure compliance. Fourth is let him share all his myths and don't laugh at the myths. Huh? Because ultimately, myths sometimes take one generation to live. So when you have a myth, what is very important to do is allow it to be spilled. The space from where the myths come, you can put science. So Dheere say, if you dent a myth, then he'll be able to take medication. Fifth is warn them of all psychiatric demons. Medical store wala, he will ask you, ये भारी दवा किसने दिया ये अच्छा नहीं है लेने को. Stupid guy. And I tell them, बाल कटाने के लिए तुम हेयर ड्रेसर के पास जाएंगे या कॉबलर के पास जाएंगे. उसका काम है दवा बेचना, मेरा काम है दवा देना. नंबर टू, टेल देम, प्रियम देम. तुमको बहुत लोग बोलेंगे किडनी खराब होएगा, लिवर खराब होएगा, मर जाओगे, मेरे यहाँ कोई साइकियाट्री दवा लेता है, वो अभी वेजिटेबल हो गया. प्रियम देम. ऐसा लोग तुमको फैमिली में बोलेंगे. ऐसा कोई बोला तो हमको आके बताओ, हम फिर चर्चा करेंगे. एंड इफ यू हैव एन अलाई, इफ यू हैव समबडी ओपिनियन मेकर ऑफ ट्रीटमेंट्स इन द फैमिली हु इज एंटी साइकियाट्री, उसको बुलाने का, मीटिंग लगाने का, क्लिनिक में बिठाने का और बोलने का, आए तेरे को मेरे पे क्या दुश्मन है रे, बता ना तेरा व्यूज क्या है. And when they talk, and when you respect this guy who's against you, he changes 360 degrees. Also, it's so important for us to understand that incremental exposure of information improves compliance. It's so important to understand that doctors can call up the patient if they have not come and ask them what they're doing. Then preempt them going to other pathies. वैद्य के पास जाने वाला है, कोई बात नहीं, तुम्हें जाना है तो हमारी दवा मत लेना. देन दे कम बैक टू यू. वेरी इंपॉर्टेंट. हाँ, ये बला के वजह से है, जादू टोना की वजह से है, किसी ने मुठ मारा इसके लिए है. नहीं यार, कुरान पढ़ो, रामचरितमानस पढ़ो, बाइबल पढ़ो, दुआ भी लो, दवा भी लो. एंड सो व्हेन यू डेंट अ मिथ, it changes. Also, when the patient shows improvement, compliance improves, myths go down, stigma actually goes down, and they become much, much better. And that I think is very, very important. My dear friends, depression is very invisible. If somebody is very depressed, rock the boat, see that he or she takes treatment because you will save somebody's life.
Oh, very well put, sir. So second last question this is from Dr. Priya. About social media induced anxiety. So how relevant is it in your practice?
It is very relevant because you get a lot of fake news. A lot of fake news. I would say that do digital detox. I don't see news at all. I use the media only for mental health awareness. Hug your wife or your husband more. चिपक के सो जाओ. गैजेट से भी वो ज्यादा अट्रैक्टिव है. Lock your gadgets after 8 o'clock. After you get up, pick up the brush, not the WhatsApp button. Have your breakfast, then check what is important for you. And don't do this forward business. And don't indulge in politics. Trump आएगा या वो छोकरी आएगी, अपने को कुछ फर्क पड़ने वाला नहीं. अमेरिकन पॉलिसी इंडिया के साथ वही रहने वाला है. एंड हिंदुस्तान में भी मोदी जी आएंगे, राहुल बाबा आएगा, कोई वो don't get into hot debates and discussions which are very confrontative, which are very humiliating, insulting, cause more anxiety. So also don't read Google too much. Google is a disclaimer model. If you read Google, you might not take paracetamol also because it can cause death. when people come and say ये सब लिखा है, मैंने बोलता ये तो आर्टिकल, मैं एनसाइक्लोपीडिया है. आपको एनसाइक्लोपीडिया का अनुभव का फायदा लेना है कि आर्टिकल्स का फायदा लेना है. एंड विद गुड ह्यूमर, with tact and analogies and metaphors, you can actually turn people around. But some of them may not turn. But sometimes what happens, doctor, is I might be able to convince him, but he might leave me. But when he goes to some other doctor, he is what work I have done will help him to become very compliant with somebody else. Last question.
Yeah. So last question is from Dr. Ravi. What are the signs that a primary care physician should spot in anxiety disorders for prompt referral?
Yeah. Shallow breathing, anxious eyes, omega sign here, lost, talking about stress again and again, saying that I don't have faith in my son, he will not pass the exams. I don't have faith in my boss, he'll throw me out. When you are in doubt, ilaj dawa ka chalu karo, because the counseling does not work when he is very stoned. At the same time, provide him with supportive counseling, allow him to ventilate, catharsis, and give him a lot of reassurance. Look at the GAD-7 symptoms. They are the symptoms which you need to follow. At the same time, when you believe somebody has anxiety, probe for depression also. Depression is very cunning. Like Ravan, it can come in many disguises. So it's important that you probe for depression, and in an event of error on the side of treatment, then on the side of not treatment. What did we do in COVID? Any fever, we believed it is COVID unless proved otherwise. That is what you have to do.
So with this, we come to end of our session. We thank Dr. Shetty sir for his valuable clinical insights, which will surely benefit the doctors who have joined it, and it will empower them in managing patients in their clinical practice. So it was
Two tips
truly a
at the end.
valuable.
Two tips at the end. All
Yes, sir.
practitioners
Sure.
who are listening, if you have
Sure.
children, daughters and sons, tell your daughters never die for a guy. And tell both your sons and daughters anxiety goes down when they're involved in family activities, when they help their mothers and their fathers in household work, when they are part of the decision making process, when they accept the food at home as it is, and when they are in touch with all the five elements: sunrise or sunset, water, earth, sky, and air. And please teach them to pray to God. Let there be an environment where people share their feelings openly. You can prevent anxiety and depression. Thank you, Dr. Charmi.
Thank you so much, sir, for your time, and truly it was valuable and truly engaging. And we also thank our audience who have joined it and spared their time for their patient listening. And last but not the least, the DocMo team for the technical support. Thank you so much, sir. Very good night.